Okay, we'll go ahead and get started. Thanks for joining us again. I am Julia Simhai. My pronouns are she, her, hers. I'll be moderating this session. We also have Kelsey Duarte here, who is managing the Zoom and making sure the tech is running smoothly. You're all muted now, but if you've got a question, you'll be able to unmute during the Q&A. And you can also use the chat box for questions during Q&A, or if you need any help with anything. If you're comfortable doing so, please add your pronouns to your name by clicking the three dots in the corner of your video square and selecting rename. And we greatly appreciate you doing that. This session has been generously sponsored by Colorado Access. So we thank them for their contributions to the conference. And I have a short message from them to read. Colorado Access is honored to be able to be a supporter of the Colorado Public Health Association Culture of Data Conference. Data is essential to making informed and thoughtful decisions and is a huge part of our deliberative process at Colorado Access. We want to sincerely thank our dedicated public health partners in Denver, Adams, Arapahoe, Douglas, and Elbert counties. We don't need much data to see that it has been a tough few years for public health workers. We are sincerely grateful to our partners and the partnerships we have forged in COVID work, hotspotting, health alliance development, and community partnerships. Viva la public health partners. So thanks again to Colorado Access for supporting the conference and this session. We have two presentations during this session, and that'll be between now and ending at 4 o'clock. Each presentation will be 20 minutes and there'll be a 10-minute Q&A afterward. And we'll have a 5-minute break between the two presentations so you can get up and stretch and do what you need to do. The theme of this session is Everything is Public Health Dashboards, Visualizing Non-Traditional Data Sources for Use in Public Health. We'll have the opportunity to hear about two different types of data visualization and how these visual dashboards or websites are being used by the presenters to make a difference in communities across Colorado. So our first presentation is Measuring and Visualizing Alcohol Outlet Density in Colorado, presented by Julia Stullken.
I had to remember to unmute myself. Good afternoon, everyone. My name is Julia Stullken. I use she, her pronouns, and I'm an alcohol epidemiologist at the Colorado Department of Public Health and Environment. And I'm going to present today on measuring and visualizing alcohol outlet density in Colorado, which is part of a larger project to create and refine a surveillance system to understand access to alcohol across the state. So during the presentation, I'm going to talk about what alcohol outlet density is and why we should care about it, how to measure alcohol outlet density, and also how to visualize outlet density. I'm going to be giving a pretty broad overview of the process of measuring outlet density and then demoing a new storyboard that's available for folks to use. But just a disclosure, I'm not going to be going into a ton of results, but those are available in the storyboard that you all can check out after the presentation. So first off, what is alcohol outlet density? Outlet density, I might refer to it just as outlet density for brevity's sake this afternoon, but outlet density is a measure of physical access or availability of alcohol in a particular area. And really, we're referring to retail alcohol outlets. So for this type of project, I used licensee data, and there's all different license types. Some of them are for manufacturers or wholesalers. Those are not included in these measurements. So we're only talking here about places where people that are 21 and over can walk in and purchase alcohol for consumption. And then just some other information. There are a couple different types of retail outlets that some people may or may not be familiar with. There's on-premise outlets, which are places where you purchase alcohol and consume it on site. And so those are going to be your bars and restaurants or music venues. And then there's off-premise outlets, which are places where you purchase alcohol in a sealed container and you take it somewhere else to be consumed. And those are going to be our liquor stores, corner stores, and in some cases, grocery stores. And talking about outlet density or concentration might be helpful in your projects or when you're communicating with decision makers or community planners, because it sort of contextualizes what the number of outlets is in a certain area. Why do we care about outlet density? Higher rates of alcohol outlet density have been associated for a long time with excessive alcohol use, which is in turn associated with a variety of health problems, which I've listed here. Excessive drinking, which is sort of an umbrella term that encompasses underage drinking, drinking by pregnant people, heavy drinking, which is having multiple drinks a day throughout the week, or binge drinking, which is high intensity drinking in a short period of time. Excessive drinking costs a lot of money too. So a study done in 2010 found that in Colorado alone, it costs about $5 billion a year to mitigate the problems associated with excessive drinking. And the Community Preventive Services Task Force, which is a body of researchers and experts who review literature and policies that pertain to community health, they've gathered all the research and data, and they've decided that regulating or limiting alcohol outlet density is an effective strategy for preventing excessive alcohol consumption and the harms that are associated with it. So that was sort of a broad reason why we care about outlet density. And then we also really care about outlet density because it's inextricably linked to social justice. Since outlet density is in part determined by licensing and zoning policies, it's been heavily influenced by historic redlining policies that have lasting effects to this day on neighborhoods and communities. And we've seen from studies done in other cities around the US that the prevalence of alcohol outlets, particularly those off-premise outlets that I was talking about, so liquor stores and corner stores, there's a higher concentration of those in communities that have more people of color and more people with that report lower household incomes, despite the fact that those populations tend to report lower levels of alcohol consumption than their white affluent counterparts. So now I'm going to get to how I measure alcohol outlet density. And the CDC developed and released a toolkit for this last year. The graphic on the bottom left is the title picture from that toolkit, and it's available on their website. And I used the methods in that toolkit for this project as well. There's 4 sort of standard indicators. There are many other ways to calculate outlet density, but these are the ones that we're kind of trying to move towards so that we can compare apples to apples, so to speak. And these 4 indicators help you contextualize what the concentration of outlets within communities looks like over time, or comparing one county to another county or one state to another state, for example. The first 2 indicators are count-based indicators. These are pretty easy or non-complex, I should say, to calculate as long as you have the right data. You don't need any special software to do this. You could do it in Excel, or honestly, even on the back of a napkin if you had to. And then the distance-based indicators, which I'll refer to as outlet to outlet or person to outlet, these measurements are a little bit more complicated and they do require special software tools. I used ArcGIS for this project, but there are other tools out there. And then within these 4 indicators, you can get more granular or more specific. So for example, today I'll mostly be talking about all outlets per 10,000 persons, for example, for that first indicator, but you could do only on-premise outlets per 10,000 persons, or only off-premise outlets per square mile, et cetera. So you can dive down into the type of outlet as well as the geographic area that you're interested in. So for this project, it started out somewhat exploratory as we were developing this surveillance system. And so I tried to calculate as many of the measurements as possible. But as you can imagine, not all of them are meaningful at every level. So for example, the rate of outlets per square mile for the entire state of Colorado doesn't really tell us anything, because there's a lot of land area in Colorado where no one lives, or there's no roads even going through them, right? So that's not a very meaningful measurement. But if you do outlets per square mile in a county or even in a census tract, that's a little bit more meaningful. And then because of time restraints, I focused on the first 3 indicators. So the ones that are displayed in the storyboard that I'll show you later, and that I talk about throughout the presentation, are outlets per 10,000 persons at the county level, outlets per 1,000 persons at the census tract level, and then outlets per square mile at both the county and census tract level, and then the outlet to outlet distance at the county level. And then just a little bit of context on the this one that's represented in green, the outlet to outlet distance. So these first 2 measurements, rate of outlets per square mile and per person, they don't capture cluster dynamics. And so a lot of our stakeholders are interested in like heat mapping or clustering of outlets. And so one of the advantages of knowing what the average distance between outlets is, or the outlet to outlet distance, is that it does capture some of those cluster dynamics. So once I had the data and I did all the testing, this is, and data cleaning and all the not fun stuff. This is just sort of an overview of the results that I found. This is not an exhaustive list of the measures that were calculated or the results that I got, but I just wanted to kind of give you an idea of some of the different ways that we can look at those 4 indicators or 4 measurements at the different geographic levels. Overall, in 2020, there were almost 12,000 retail outlets across the entire state, and about 70% of those were on-premise locations. So just a reminder, those are our bars and restaurants. And then in general, the rate of outlets per 10,000 persons was relatively higher in rural resort communities, where there's a smaller year-round population, but maybe there's a high population of tourists or seasonal residents. And then similarly, the rate of outlets per square mile was relatively higher in urban areas, which is somewhat expected, just because of density of urban areas. But you might be looking at this slide and thinking there's a lot of numbers and it doesn't really make sense, or it doesn't really tell me that much. And so that's why it's important to think about how you're going to visualize your data once you have it. And I spoke with a lot of stakeholders throughout the process of doing this, some like grantees that work at the county level, and then some folks that work with the state Epi Outcomes Work Group. And someone had recommended using social math to try to help people maybe who aren't super math or stats focused, to help them to visualize what a rate of outlets per 10,000 persons, for example, would mean. And so that's how we came up with this graphic. In 2020, there were 22 retail outlets per 10,000 persons in Colorado, with enough seats for 50,000 people, Coors Field would have 110 places that sell alcohol if it had the same outlet density as the state. And I chose Coors Field because I wanted to pick something that is recognizable to Coloradans, but the irony that it is named after an alcohol manufacturer is not lost on me. So I am going to share this story map. The link, which I'll share in the chat when I'm finished presenting, is now publicly available, and it brings you to this landing page. So this is called, I'll refer to it either as a storyboard or a story map. Story map is just an Esri ArcGIS application for storyboarding. But it brings you to this landing page, and it encourages you to keep scrolling down. And I'm going to go ahead and just give like an overview of what's in this story map because I want people to use it. So I want you to explore it afterwards. So I'm not going to give all of the juicy details away, but in general, the beginning of the story map starts out with a lot of the information that I already shared with you about what alcohol outlet density is, how do we measure it. I also included a section on interpreting outlet density because, like I said, it can be challenging to know what measurement is going to be most meaningful to your community or to the geographic area that you're thinking about. There's also no threshold for high or low. Like no one has put a stamp on something and determined like this number of outlets is safe, right? And so instead, what we try to do is compare a place that has relatively higher outlet density to relatively lower density. And so you can either keep scrolling or you can click the navigation at the top. And there are a number of interactive maps, and you can just keep scrolling and it will just bring you right through the ride. So each of the maps has a like a side panel on the left where I tried to include information about what you're looking at in the map. Each of the maps also includes a legend in the bottom left corner and a zoom function, so you can zoom in and out. And if you keep scrolling, it'll bring you through the different maps with the different measures. The legend will tell you what the colors are that you're looking at for the Coral Plus maps. So here, darker is a higher rate of outlets per 10,000 persons. But let's say you want to know what the just overall frequency or number of outlets is in your county. You can click on the map and it will open a little window with the metadata, and you can scroll through and see all of the data that goes into making this layer on the map. And you can do that for each of the maps. And then I also included, so there are a number of other maps if you keep going. There's multiple for county level, and then it'll take you through the census tract level. But for the sake of time, I'm going to move on. There's also a section on just general drinking behavior. So I included 5-year estimates from the Behavioral Risk Factor Surveillance System for prevalence estimates of binge drinking. And it's not perfect, but I wanted to just help people put it all in one place, basically. So you're looking at outlet density, and then if you're curious what drinking behavior looks like in your community, you can see it all in one place. And then I'm going to scroll through. I also included links to the Healthy Kids Colorado survey. I wasn't able to include actual like interactive maps from HKCS, but they do have a great dashboard, and there's a link on the sidebar that'll take you directly to their dashboard too. And then finally, I included a section on considering alcohol outlet density through a health equity lens. So some of the stuff that I already talked about at the beginning about why we care about outlet density is included here. And if folks are interested in like where that research comes from, I do reference things in the text, and then I have a reference section at the end. So folks are always welcome to read about that if they're not familiar. So this first map, I included two maps that kind of focus on health equity here. The first one shows on the left, it's the percentage of the census tract that identified as a minority race or ethnicity. So the darker colors are census tracts where a higher percentage of the population identified as a minority. And then on the right, we have the rate of off-premise outlets per 1,000 residents. And if you'll remember from the beginning, off-premise outlets tend to be higher concentrated in communities of color, and they also tend to be associated with higher rates of violence and some of the less desirable traits that go along with community disinvestment. So that's why I used off-premise rate here. But the same thing applies. You could click on this county and see the metadata behind it if you wanted to look at something besides off-premise. And then the second map in this section looks at, on the left is the percent of the population in the census tract that had a household income below the federal poverty limit. And then on the right, it is the rate of outlets per square mile in the census tract. So I'm going to go back to the presentation. So I know that was a super quick and dirty overview of outlet density and of this tool, but there are a number of resources that are linked at the end of this story map, and then I linked a few of them here as well. I wanted to, I know that the link to the story map is not very beautiful right now, but you can also find it by going to our CDPHE alcohol webpage, which is the third link here. I also want to call out the CDPHE open data portal. If you're not familiar with the open data portal, there's a ton of maps and data that you can download there for public use. And the two layers that I used for creating the outlet density maps, so there's one for the county and one for the census tract level, those are both available on the open data portal. So if you go to the CDPHE open data portal and you search alcohol, you can find those there. And then there's also other amazing resources on the open data portal, and your county or city may also have an open data portal, so check those out too. So I know there's a lot of information, but I appreciate your time and attention, and I'm happy to take questions, or if people are interested in doing a similar project or using the information on the story map for other projects, then I'd love to talk to you about it. So that's my email.
Thanks very much, Julia. That was great. We have got up to 10 minutes for questions, so feel free to put things into the chat or unmute and ask Julia any questions that you have about what she just presented. While we're waiting for others, I can jump in with a question about, I obviously haven't read or looked at the story map in detail yet, but I was just curious, as you showed a little section on equity and how to think about this data, and just wondering what factors went into that, and how did you approach wanting to frame this data? Because I think the framing of data is really important when you're putting things out to the public like this.
Yeah, so I'm going to start my answer to that question by just saying, like, I have a long way to go, right? To like, we're never going to be perfect, but to improve on the story map and how we frame outlet density data, but also substance use data in general through a health equity lens. But I approached it by thinking of what the research says already. And like I mentioned at the beginning, lots of studies have been done that show that historic redlining and just general like community disinvestment have affected the outlet density in low-income minority communities. And then, like I said, despite the fact that those people report using alcohol less often than white affluent people. Also, just the type of alcohol that's available in those communities tends to be like high sugar, high alcohol percentage, what I would consider like predatory marketing tactics. And so I wanted to frame it from the perspective of, regardless of people's alcohol use behaviors, what are the systemic factors that are associated, right? And so I consider availability of alcohol in a community to be a systemic factor. And so that's sort of how I try to approach it. And there are disclaimers in the story map that you'll see as you explore it, but in the future, I'm hoping to do more like analysis. So right now, this is all observational data. Like, as you could see, the slider allows you to see one map on one side and the other map on the other side, but there's no like mathematical association behind those yet. But that is like a next step, is I'd like to replicate some of the studies that have been done in like Chicago and Baltimore and Atlanta on outlet density and violence. I'd like to try to replicate some of those for Colorado to see like what our data tells us.
Thanks. Yeah, I think you sort of touched on one of the questions that came in about next steps and how this will be used or is currently being used, and how often you plan to update it.
Yeah, so ideally, I think I'd like to update it every like 3 to 5 years. I do continue, like every January, I download the licensee data from the Department of Revenue, and I update sort of like my figures on the back end. The story map won't be updated every single year, partially because the number of outlets, unless there's a huge policy change, the number of outlets doesn't really change that much from year to year. So having like 2020, 2021, 2022 wouldn't tell you a ton. So kind of to be determined on how often it'll be updated with new like outlet density data. And then how it's being used. I'm hopeful that communities, specifically like grantees who are working on substance use prevention, can use this either as like an informative tool when they meet with stakeholders. Also, I think knowledge is power, and like we don't know what we don't know. So one of my goals with this project of just like creating the surveillance system is just like digesting the data from the Department of Revenue on alcohol licensees into something that more people can use, and that's like a little bit more approachable. Oh, and I will put my email in the chat.
Thanks. Are there other questions or things that you want to ask about this alcohol outlet density work? Got a couple more minutes if no one wants to jump in.
Excuse me. I'll also just say that um, if you're interested in doing a project with outlet density of any retail substance, so whether that's alcohol, tobacco, marijuana, exploring the story map is a great place to start. I think if you're interested in alcohol outlet density, what you're looking for might already be there. If you want to start on a new project and you're not really sure where to start or like how to find data, part of my role as the alcohol epidemiologist at CDPHE is to provide technical assistance. So folks are welcome to reach out to me to learn more about like where to find data and how to think through starting a project like this.
Great. Thanks so much. That's a really great resource for people across Colorado. Okay, well, if there aren't any more questions, we'll move into our break, and we'll probably also have time at the end of the session for open questions if you think of anything between now and then you want to ask Julia. But thanks again for your presentation. We'll go ahead and take a 5-minute break before we reconvene for our second presentation. So we will come back at 3:23 Mountain Time and get things moving again then. So stretch, get up, do what you need to do, and we'll see you in a few. Okay, welcome back, everyone. Hope you had a good break. We will move on to our second presentation of the session, which is called Working with Colorado Prosecutors' Offices and Community Stakeholders to Develop Data Dashboards and Examine Disparities. Our presenters are Lauren Gase and Joe Beletic. So I will hand it off to them to share their presentation.
So much, Julia. We are really excited to be with you all this afternoon and share a little bit about this project. Quickly, we are from the Colorado Evaluation and Action Lab, which is situated within the University of Denver. The lab was created in 2017 under leadership of the governor's office. We believe that government can be most effective and efficient when all sectors, public, private, nonprofit, and academia work together. So we work with a range of state and local government partners across a variety of issue areas. Today, we're going to be talking about some work in the justice space to obtain the best available evidence. We work to support partners in understanding whether they're meeting goals, support innovation, and ensure that resources are used wisely. So a little bit about this project. District attorney offices have significant decision-making power. They can decide whether criminal charges are brought to court, whether cases are dismissed or diverted from court, and to some extent, the sanctions, the sentences that people convicted of crimes will face. And we know that increasingly, district attorney offices are expected to take proactive, engaged responses to community problems, to reduce disparities in the justice system and outcomes, to build greater trust, with the community through engagement, and to increase transparency and accountability. And to do this really requires robust data-driven work. However, data are currently stored in a case management system in Colorado with no or very limited aggregation, review, or meaning making, or public sharing. So the goal of this project was to support DA offices with these three pieces, starting to really review and make meaning of their data and track progress toward greater efficiency, effectiveness, and fairness, identify possible racial and ethnic disparities, and developing solutions to reduce disparities, and improving their engagement and accountability with the public. So you may be thinking, what is this session doing at a public health conference? I don't think I maybe need to say this, but justice system involvement is a social determinant of health. It impacts a range of factors, including employment, income, housing, food security, social inclusion. And it's also a driver of health equity. And a key component of this project, as I mentioned, is conducting an analysis of disparities. We also think that this is a really cool example of a meaningful researcher practitioner collaboration, that Ninez was talking about earlier today. And we hope that maybe there's some opportunities to think about your own work and how to build data-driven organizational culture and support transparency. And lastly, there is an opportunity for statewide impact. This data will hopefully soon be available to you as stakeholders, both in your professional or personal roles. And we want to be able to get your input on how to make this meaningful and useful. So we will leave plenty of room for discussion at the end. And if you have any questions that arise, please feel free, or comments, please feel free to put those in the chat. So this project represents a partnership between 4 entities: the National Prosecutorial Performance Indicators Group, which is a national entity based out of Loyola University Chicago and Florida International University that works with prosecutor offices across the country to do this type of work. Our lab at the University of Denver, we are the local research partner. We're funded by the Microsoft Justice Reform Initiative, And of course, we have our partners in district attorneys' offices. So this project is occurring over 2 phases. We've actually really kind of just begun. We're about 7 months in of a 2-year project. We're in phase 1, which we're calling piloting. We're working with 8 judicial districts in diverse areas across the state, including both more urban and more rural jurisdictions. We're working with those to really assess and begin to build their internal capacity. We're also working with them to design and implement both internal and external facing dashboards. So the internal dashboards, right, are really designed to help them look at their practices, identify opportunities for improvement, set targets, right, spur that internal improvement discussion, move toward data-driven prosecution. And the external dashboards are really intended to support that goal of community engagement, transparency, et cetera. We're using these 8 as a pilot to develop tools and processes that will support statewide scale. So Colorado is pretty unique as a state in that all 22 of our judicial districts use the same case management system for internal tracking of decision-making, outcomes, et cetera. So in phase 2, that will be our goal, to use what we learned from the 8 to expand. So all 22 judicial districts can have both internal and external facing dashboards using templates that were created. And then again, we can think about in phase 2, enhancing really statewide data capabilities. So I'll turn it over to Joe for this slide.
Yes, sorry, I was on mute. I started talking, of course I did that. But I'm Joe Beletic. I'm a researcher at the Colorado Lab as well, so one of the research partners on this project. So in terms of what types of data we're looking at both like general process information as well as specific indicators. So by general process, what we mean here is, you know, what types of referrals are coming from law enforcement, and of those referrals, what's being filed. So what's these offices deciding to prosecute. We're also looking at, you know, what would the case dispositions be? So how are cases being resolved? Are they being dismissed? Are they being diverted? If they're going to trial, what are those outcomes? Are most of them, you know, having some kind of plea deal? And then also what sentences are being imposed. So everything from, you know, what types of cases are going to Department of Corrections, incarceration, to, you know, perhaps what types of cases are getting sentences of probation or community service and other sentences. And then in terms of specific indicators, these are based on the prosecutorial performance indicators, which can be found at this URL link here. We'll also share this in the chat at the end of the presentation. But there are specific indicators that speak to performance in kind of 3 different areas. So performance in capacity and efficiency of limited resources, performance in terms of community safety and well-being of the community, and then performance in terms of fairness and justice. And so some of these indicators are listed here. So they look at things such as length of time it takes to resolve a case, so timeliness in the justice system, ways and timeliness of engaging with victims and witnesses in the general community. It also looks at things such as referrals to diversion and outcomes of that diversion, and whether diversion is successful and maybe how that relates to future recidivism of those individuals who are diverted. I know Lauren spoke to how we're doing a disparity analysis as part of this project, but many of the indicators look at things such as victimization or office practices or case outcomes based on race, ethnicity, or socioeconomic status. And then lastly, some of the indicators look at things such as procedural and ethics violations or compliance with discovery, as well as conviction integrity. So I would encourage anyone who's interested to kind of click into this site and look at all potential indicators. Obviously, much of what we're working on at the moment is based on what's been prioritized in terms of what's important, as well as what's feasible in the data that we have at this point. So kind of what we've done up to this point, I'm going to speak to a couple of our key achievements. Really, our first is building internal capacity, which I know Lawrence touched on. And one thing that we've done that has been kind of vital for this project is build work groups in each of the 8 pilot sites that we're working with. So in each of those 8 jurisdictions. And really, those work groups are comprised of members from across the office. So individuals who are both in formal and informal leadership roles and that have varied levels of tenure with the office. And are in different units. So we have, the work groups comprised of prosecutors, as well as, support staff, such as legal secretaries, to individuals who may work in the victim witness units or who are maybe more in an investigator role. So we like to have that diversity of perspectives in those work groups because it really helps each of those individuals be a liaison for their units and kind of speak to the information that they would like to see that would be most beneficial for their work. And it also allows us to have champions in different parts of the office to speak to this project. We have conducted also an internal capacity assessment in each of the offices. So that was a short survey that was conducted, that was distributed to all staff to understand kind of our benchmark of where we were starting, like where were office practices and priorities, what were some of the prosecution strategies and how did the staff feel about them? What were staff's perceptions of their office's role in community engagement and how they were doing with community engagement? And how did they understand and think about disparities within the criminal justice system within their district? As well as like how they thought their office played or did not play a role in those disparities. So those results have really helped us kind of ground the work in how we're going to strategize the internal communication, how we're going to address, potentially training needs that may exist, or, maybe if there seem to be a need to boost morale, how we can use this project to kind of strategize the work in that direction. So for example, if, based on the capacity assessment, if staff felt that there was a need for transparency with the community, we can emphasize how the dashboard can support that goal. So using that capacity assessment to really understand how to strategize internal communication, the value for the staff in different roles. Another thing that we're working on with the work groups is prioritizing the set of indicators. So again, thinking through, what pieces of information are most important at this point. And we're also, thinking through, as I was speaking to, not only, what's most important, but what indicators can we look at reliably? So if there's something we're interested in, but we know the data is not reliable, where can we improve data collection strategies to be able to see that better in the future? So an example of that, and this kind of speaks to conversations that have happened in other groups today, is like the data on race and ethnicity we know isn't very good. So how can we strategize ways to improve that data collection? So yeah, that's the first part of how we've built internal capacity and kind of our key achievements to date. A second thing we've been working on over the last few months is fostering connections to the community. So each of the pilot sites have been required to, as part of like participation in this project, are required to do 2 points of community engagement. So the first is kind of happening right now, and it's a point of engagement where we want community feedback in terms of what indicators we're selecting, what data we're trying to put on these public-facing dashboards, so that it's valuable and useful for the community in terms of what they want to see from the prosecutor's office. And then the second point of engagement for this project would be, once the dashboards are released, to be able to have a session where we're sharing results and we're making meaning of the data alongside the community. So the community engagement is a responsibility of the work groups, but obviously we're trying to support in a way that not only serves the purposes of this project, but kind of sets up a two-way dialogue that can be more sustainable in the future to foster relationships and kind of work towards the goal of this project, which is that transparency and that trust between prosecutors and their community. Additionally, I would just say another focus of what we're doing with community engagement is seeking to center the voices of those directly impacted by the criminal legal system. So that includes strategies such as power mapping, which individuals may be marginalized in your community and how these offices are reaching out to make sure those voices are incorporated into these listening sessions. Working across all eight offices, they all have very different strategies and approaches. So one thing we're attempting to do is to bring all of these 8 offices together to kind of brainstorm strategies for engaging the community so that we can lift up best practices or think through maybe, where we're getting stuck or obstacles in terms of having meaningful engagement. And one thing that has kind of arisen from bringing all these different offices together is an upcoming Denver Metro listening session. So we're finding that obviously, the population isn't stagnant in their district, but are mobile, especially across the Denver Metro area. So having a listening session that goes beyond just one district and is a listening session with multiple districts in the Front Range together so that they can listen to shared concerns across the area and think through, what concerns the population has that goes beyond their district's boundaries. Okay, I'll turn it back over to Lauren to kind of speak to how this lays the foundation for statewide scale.
So I hope what you have been able to see in what some of Joe has been sharing is that we are treating the process of developing these dashboards as just as important as the actual outcome of the dashboard itself, right? Of course, we could go get the data, sit in our offices, develop a dashboard and give it to them, but would that reflect meaningful information to them? Would they ever use it? Would they have buy-in to it? Would the community care about those pieces? No, probably not. And so we've been very intentional throughout the project of being able to turn leadership over to them, be guided by what the community cares about, etc. The other strategy that we use that I think has been critical to support ownership among these offices is to convene them in quarterly cross-site learning meetings. So the learning meetings, the offices come together to talk about what they're doing, how are we going to make decisions that help compare apples to apples, around common language, common definitions. What are we going to prioritize for improvement, right, among the long list of things we want to do better. And also there's a sense of like peer-to-peer sort of like healthy competition, right? So when you hear what someone else is doing, I think it kind of spurs you to maybe think of ways you could do that and ways that's applicable within your jurisdiction. We're also doing a lot of documentation that will support statewide scale, like common definitions, data collection practices, improvements to the case management system, et cetera. We've also developed a regular newsletter for stakeholders. We'll include the link to that at the end. And it's something that's available for anyone who wants to kind of follow along with our process, access the tools we're developing. The primary audience of that newsletter is judicial districts who are not part of the pilot, right? So they can kind of get going on their own. And then of course, at the end, we will package resources and tools. So we're excited to hear questions or we're also would love to hear from you. Here's just a couple of questions that are really kind of top of mind for us. What's important for us to consider as we move towards statewide scale? And also where are there opportunities to further center public health in this work? And any thoughts on those questions or other pieces or other questions that you have, we are happy to answer. And then just on the last slide, we have some links to the newsletter I was mentioning, as well as our emails and the project site. Oh, and the other thing I'll mention super quick is the Colorado Lab also has something called Link. The presentation this morning made me think about it. It's a state collaborative that supports research evaluation and analysis using integrated data across state agencies. So feel free to check that out as a resource to help with some of those data silo issues.
Great. Thanks very much, Lauren and Joe. That was really interesting work that's going on. So yeah, we'll open it up for some questions for them, or if you have answers to the questions they put on the screen, feel free to chime in with those. So I'll give folks a second to get your questions in chat or unmute. One question I had was, what was the reaction from the pilot sites when you brought this to them? And if there was any pushback, how you addressed that? I imagine for in some cases, bringing data to light that hasn't been in the light, it's scary sometimes for folks. So just curious if you encountered that and how you addressed it.
Yeah, that's a great question. So when this project opportunity came up, it was actually brought to us by one of the judicial districts that was very excited to move forward with this kind of transparency work. And the lab had done some earlier work with Denver, looking at racial disparities and points of prosecutorial discretion. And they had done sort of an internal meeting about this, which we were a part of, again, across all jurisdictions. We put out the call to all 22 offices, and the 8 pilot sites that we got all volunteered willingly, knowing what would be expected of them in terms of requirements for public facing dashboards, in terms of internal working group and time commitment. And so I think that this is an issue area that, in my opinion, the offices really believe in and think is important. This crosses party lines. We have both Republican elected and Democratic elected DAs participating. And they really just want to be able to be responsive to what the community is asking for. And of course, you know, there is hesitation, you know, about some of this, of course, within the offices. That's something that we've surfaced really early on with the work group and helped develop messages, as Joe was saying, to help address that and to cultivate that internal buy-in. It's a process, of course, because it's different, but I think in general, all of our partners have been very, very excited and wanting to pursue this work.
Great. It's always nice to have some willing participants raise their hands. Any other questions about this presentation?
Any thoughts you also have on the questions we posed also would just be super helpful in the chat, for example, if that would be a way you want to share some feedback. We would just love to get any reactions, you know, from the public health community as well.
Got a quiet room this afternoon, it looks like. Anything, or Joe, did you want to add anything?
I was just going to add, so our project website, if you, I linked that, if you click there, you can see the 8 judicial districts that are currently, you know, part of our project, our pilot site. So, you know, I also encourage anyone as not only, you know, here as part of the conference, but as, you know, as a citizen, if you're part of living in any of these districts, you know, I encourage you to get involved too if you have any input in terms of what you'd like to see from your district attorney's office and prosecutorial decisions.
Great. Well, I'll open it up if there's any questions for Lauren and Joe, as well as if anyone thought of anything they wanted to ask Julia about her presentation, we can circle back to that. Just give a few moments for folks to submit anything lingering before we do a little bit of wrap up. All right. I'll wrap things up. When you think of questions or revelations, later tonight when you're trying to fall asleep or something, you've got the contact info for our presenters. So you can reach out to them then. And thank you all for sharing about your work, some really interesting ways of looking at data and bringing new ways to look at data that has potentially existed but not been examined in these ways before. So that's really informative. A few short announcements before everyone heads out. As you heard earlier and probably know by now, the slides and any handouts that speakers have are available on the Sketch website. Watch your email tomorrow afternoon for the post-conference email that you'll get, and that'll include the conference evaluation, which we really appreciate you filling out, and you can be entered in the raffle if you do fill that out. And this session wraps up the first day of the conference. So you are done for the day after this. We hope you enjoyed it, and we will pick back up tomorrow morning from 9 a.m. to 12 p.m. The plenary begins at 9 a.m. and features a talk entitled Community Health and the Pandemic Response in Colorado. So we hope to see you there, and for the breakout sessions that will follow that. As a reminder, there is the walk and learn available. If you didn't get a chance to already listen today earlier, you can check that out. And there's a second one also on the schedule for tomorrow. But again, both those are available at any time for you to take a listen. So thanks everyone again for joining us. Have a good evening, and we will see you back in the morning for day 2 of Culture of Data.
Thanks, Julia.